I wanted to be a nurse ever since I could remember.
What we've always done in our culture with our educational system is based on intellectual understanding, analysis, criticism, discussion. But what is so sorely missing is the part of comprehension that can only come to us through insight.
In my view, insight is critical thinking. It's that place where we tap into the internal wisdom. It's where we know, like, something's not right, and we just take action on that. That's insight. Since nurse coaching is still pretty new, a lot of people are trying to figure out, what do I do with nurse coaching, right? Nurse coaching is really about communication, about deep listening, listening beyond the words. Nurses are really good at that.
Nurse coaching can benefit every nurse at every clinical area, at every stage of their client's life.
What brings nurses the top of level of coaching, in my view, is we never stop assessing. That's our training. We notice everything about a patient, a client, even our family. And I think we sometimes do it without even realizing. We just take in the information, and that's what makes nurses great coaches. Nurses forget how much they know because it's just common knowledge to us. And our public needs to know.
Welcome to the Nurse on Purpose podcast, where we challenge media stereotypes about nursing and spotlight the incredible and diverse roles nurses play in healthcare. I'm your host, Nelo. Every week, I'll be joined by a nurse who is reshaping the narrative. From frontline care to leadership, education, innovation, and beyond. Our aim is to show the world that nursing is so much more than what we see on TV. Together, we'll explore how we can collaborate with media and other stakeholders to create authentic and inspiring portrayals of nurses. Let's begin the conversation and ignite change, one episode at a time. Hey guys, and welcome back to the podcast. Today I have a very special episode with me, two amazing guests, Lynn McCright and Teresa Walding. Lynn McCright and Teresa are visionary leaders in nurse coaching, blending decades of nursing experience with the transformative power of the three principles. Together, they co-founded Advancing Nurse Coaching, pioneering a holistic approach to healthcare. Through courses, webinars, publications, and coaching, they empower nurses worldwide to embrace compassion, resilience, and inner wisdom, revolutionizing patient care. Their dynamic partnership exemplifies a shared commitment to transforming healthcare from the inside out, inspiring nurses to thrive personally and professionally. With Lynn and Teresa, the future of nursing is brighter, more compassionate, and filled with limitless potential. It's such a pleasure to have both of you on the podcast today.
Oh, delighted to be here. Thank you so much for having us.
Thank you. Thank you. You guys are like nursing besties. Working purposefully together. It's like iron sharpening iron. That's the best kind of connections. Yeah. So I just wanted to start by hearing about you guys' story. I want to talk about your mission, your purpose, and your work in coaching. But first, I want to hear, how did you find yourself in nursing to begin with?
So I wanted to be a nurse ever since I could remember. I remember at 7 years old, I fell down and skinned my knee, and then house mom came out and got me and brought me in and washed my knee up. And she said, "Can my daughter put the Band-Aid on your knee? And she wants to be a nurse." And I was like, I want to be a nurse.
Oh.
And then about a long time later, when I was 24, I was sitting outside the Idaho State Tax Commission, and one of my friends asked me, she goes, "So Teresa, what do you want to be when you grow up?" And I said, "Well, I'm going to be a nurse." And she said, "When are you going to start that?" And I went, "Oh, I'm 24. I might need to want to start that." And, a couple hours later, my sister called and said, "Can you watch my daughter so I can go sign up for nursing school?" And I said, "Nope, I'm going with you." So I did. And that started the ball rolling. 6 years later, I was a nurse.
That's amazing. And Lynn, what about you?
Well, I was very fortunate in that my mother's sister and her aunt were both wonderful nurses, and I really followed in their footsteps. But also, I grew up on a farm, and I had the opportunity to sit with our old dog as she lay dying. And I just knew in that moment that that was a beautiful, beautiful sacred space, and I wanted to have that as my career.
That's wonderful. Now, both of you have started this company called Advancing Nurse Coaching. Can you talk a little bit about this business and what was the inspiration to start it?
Well, originally we had started as a group of 7 friends to open a holistic nursing business, and they all had different modalities that they practice, everything from music therapy to essential oils to Reiki, healing touch. And at some point I realized, well, if I were going to have this business, which I had incorporated already, I needed to bring something to the table.
Yeah.
Only problem was I didn't have a modality. So what I realized was that the most important thing for me were the principles that I had learned several years back, and that not only was that what I had to bring, but I actually needed to bring that as the primary thing. And I went to all of my colleagues and let them know that I didn't have time for their lavender oil, but if they wanted to join me in the principles, I would be delighted to work together with them. And Teresa said yes.
Awesome. And then Teresa, let me just let you also talk to this business and how you kind of develop this passion and love for coaching as well.
So Lynn talked about the principles. So one day we were in the car and we were talking about the business that we wanted to start. And, again, I didn't have a modality that I was specialized in. I had tried all of them. I have taken many courses on them. But she goes, well, I want to bring it the 3 principles. And I was like, well, what is that? And she goes, well, I can't really explain it. And I went, my nurse brain went, I went to nursing school. I bet I could figure it out, right? And she really didn't say a lot more until we came to a conference about, 8 months later. And our guest speaker was Dr. Keith Blevins. And that was the only thing he talked about were these 3 principles that we brought through to our business. At that particular time, I was going through quite a lot of health struggles and family struggles. I learned about worry that day, that worry was something that wasn't very helpful to me. The realization that I didn't have to and that everything would be okay, actually in the middle of the conference, I had a healing moment of like, oh my goodness, this is what I've been looking for through all of the doctors, the appointments, the modalities. This is what I was looking for. It's that internal dialogue that we all live in, that we are directly connected to our mind, body, and spirit.
Wow.
And the realization kind of sent shockwaves through my body. And the chronic pain that I'd been having disappeared because I finally understood there was no purpose in the worry.
Wow.
And that day, Lynn and I both looked at each other. It's so funny. She goes, there's this thing called nurse coaching. And I said, I'm going to be a nurse coach. She goes, I'm going to be a nurse coach. And so a month later, we both signed up for Wisdom of the Whole.
Yeah.
And 6 months later, we opened Advancing Nurse Coaching.
That's wonderful.
Like we just knew.
Yeah.
We just knew that that's what it was. And so here we are.
And now I understand why it was tough for Lynn to explain, because it's something that you kind of have to experience, to get it. So can you talk more about these 3 principles?
They really come to us through insight. And that is the entire goal. What we've always done in our culture with our educational system is based on intellectual understanding, analysis, criticism, discussion. But what is so sorely missing is the part of comprehension that can only come to us through insight. And Teresa will talk more about that.
You know, it's interesting that in my view, insight is critical thinking.
Yeah.
It's that place where we tap into the internal wisdom. It's where we know like something's not right and
Yeah.
we just take action on that.
Yeah.
That's insight.
Yeah.
Some people call it informed knowing.
Mm-hmm.
The interesting thing about the three principles is everyone's using it all the time, whether they know it or not.
We call it nursing intuition.
Yeah.
Yeah, just like Jen Johnson talks about nursing intuition. I don't know if you know the book that she wrote, The Power of Nursing Intuition, and that this is scientifically backed,
That's right.
So it's important that we're keying into our deeper wisdom, right? Because,
Right.
like you said, everything has been so kind of cerebralized. And if there is no study to prove it, then it's not real. But there are things that come from within us that maybe science hasn't caught up with yet. And it's actually the other way around. That's wonderful. And when did this business actually get founded? What year was this?
We incorporated in 2014,
Wow.
but because of the change from holistic nursing modalities to nurse coaching, we opened our school in 2016.
That's great. And what does nurse coaching look like in practice, right? Like what does the nurse expect when they come to meet with you, and what do you give them in turn?
We have a double way of doing that. One way is that we teach nurses to become coaches, and that nurse can then either work with their colleagues, their health professional peers, or they can work with the public.
Okay.
And sometimes a combination of the two. Actually, Teresa, you could talk about what you had just sent to the graduate student in Minnesota, the paperwork about how we document what we do.
So, you know, there's still, since nurse coaching is still pretty new, a lot of people are trying to figure out what do I do with nurse coaching, right? Nurse coaching is really about communication, about deep listening, listening beyond the words.
Yeah.
Nurses are really good at that. Like, what's going on here that the patient's not telling me?
Yeah.
Or if I listen to what they're actually saying, they'll tell me what they need and they'll tell me how to treat them. And so nurse coaching becomes this huge curiosity about someone else's world to empower them to become the best that they can, no matter what they're experiencing in life, whether it's a health journey or, you know, they do have a terminal illness. I've seen people be the most healthy they can be at the end of life. So it's not just about a one size fits all. It's how do we live our life the most healthy way that we can? Because really, the life we have is what's happening between birth and death, right? So
Absolutely.
knowing how we experience life actually gives us a step up to go, you know what do I want in my life? What do I need in my life? That doesn't come from somewhere else. That comes from within here.
Yeah.
So the documentation that Lynn's talking about is how do you actually document someone's insight journey or their realization health journey?
Yeah.
The best way to do that is through stories and metaphor, because everyone has a story. Everyone can hear a meaning beyond the words. Music is perfect for that. We can use all of that in nurse coaching. Whatever is right for the patient. If they say it's right, then we explore those options.
Well, and it's beautiful that every clinical area can benefit from nurse coaching. So we have no limits as a profession in regard to how nurse coaching can be used. Actually, the National Institutes of Health did a study, and it showed that 25% of nurse coaches are working in the community. 25% are working in the hospital. Well, that leaves 50%. Where are the 50%? They're out in the community. They're working in labor, midwifery centers. They're working in school nursing. They're working in hospice and end of life, anywhere in between. So nurse coaching can benefit every nurse at every clinical area, at every stage of their client's life.
Yeah. And just to clarify again, when we talk about nurse coaching, some people have a hard time understanding what that term means. So are nurses coaching nurses? Are nurses coaching the public? Or, and why is it nurse coaching specific when they're coaching the public? Is there something special about the way a nurse will coach versus like a life coach or any other coach? What is different about that term, nurse coach?
Well, I'll just say one sentence first and let Teresa explain more about it. But nursing is the first and only profession that offers a board certification in coaching.
Yeah, yeah.
So we're way ahead of the curve. There will be others. Yeah. But right now, we're the only profession that is recognized at a board certification level to do coaching.
That's wonderful.
And you were asked if, what nurse coaching is. And some people have like, so do you just coach nurses? No. I started saying it nurses as coaches.
Yeah, yeah.
Because we are coaches. What brings nurses up to the top of level of coaching, in my view, is we never stop assessing. Yeah. A nurse is, that's our training. We notice everything about a patient, a client, even our family. And I think we sometimes do it without even realizing. Yeah. We just take in the information, and that's what makes nurses great coaches. Yeah. Number one, we have curiosity. Number two, we have clinical skills and training. We take all the science, the math, we're not a STEM profession, but really we are. Mm-hmm. Nurses are doing research. Nurses are doing technology. Mm-hmm. And what gives us an extra level up is we might, a patient or a client may be talking about, a life event. Yeah. And we'll be going, but didn't you say, like every day at 2:00 you fall asleep? Mm-hmm. That alerts a nurse, like, what else is happening here? Mm-hmm. Well, it's not just a life event. It could be something else. Mm-hmm. So we can use that information in our coaching to help uncover things for our patients that maybe they don't even know that's there. And we're really, really good at pattern recognition.
Yeah. MacGyvers, we are.
Yeah. And problem solvers. We love to solve problems.
Yeah.
The other thing about a nurse is we have knowledge that is so common to us, we forget that how much we know.
Yes. Say that again. That is so true.
Nurses forget how much they know because it's just common knowledge to us. Yes. And our public needs to know.
Yeah. So important. I want to go back to something that you mentioned while at the conference, and you were dealing with a chronic health issue, and upon realization in your mind, your body naturally began to heal. Mm-hmm. Talk about this mind-body connection, right? Because I think people experience it, but they don't know that there's truth to this. Like there is something to what you feel or what you're going through in your mind can affect the way your body responds, and can actually exacerbate illness. So can you talk about really this mind-body connection and this, concept that real health begins from the inside out?
At the conference prior to that, I'd been about 5 years worth of chronic pain, like muscle aches, indigestion, kind of dissatisfaction with life. Mm-hmm. And every bone in my body just hurt. And I didn't know that your body actually listens to every thought you think. You are always living in the feeling of your thinking.
Oh, good. That's so good.
And when we miss the love letters that our body is telling us, whether it's a back pain, in my case, at one point I had going through a particularly stressful time the night before this person came home. A plantar fasciitis come up. Like it started as just a dull ache, and within 2 hours I couldn't walk. I thought, what's going on with that? And you know when it stopped? When I knew she was going to be okay.
Wow.
And I thought, And I never made the connection, like, oh, I must have hurt myself, and I started noticing different sensations in my body were giving me love letters that said, hey, pay attention to what's going on inside of you. And I noticed that I could shift the way that I was feeling by recognizing what I was doing with my thinking. Yeah. And I started to see the dynamic of, wow, it really is true. We are not separate from anything. Our mind, body, and spirit are all one thing. They're all here to serve us.
Wow. So powerful. First, I'll have you, if you want to add anything to that, Lynn, and then I'll talk.
Well, Teresa is a nurse, and she found a huge amount of relief when she learned how the principles work. She is a walking, talking role model for that.
Yeah.
And just a minute ago, we were talking about who it is that nurses coach. Nurses coach health professionals. Why are we doing health professionals?
Yeah.
Because health professionals are one of the most needy groups right now in regard to understanding their body, mind, to spirit connection.
Yeah.
And as part of, we came up through the American Holistic Nurses Association, and that actually is the group that does the national board certification. But we, in their tenets, they have three. Taking care of the nurse first is the third tenet. Taking care of the nurse first. It's so outside the box. But also taking care of the patient as a whole, body, mind, and spirit. Yeah. That's the first tenet.
Yeah.
So how do we take care of the nurse first? Well, we go back to the first tenet, taking care of the person as a whole, body, mind, and spirit.
Absolutely.
And so often we leave that out. And right now, we're just in a situation in our profession where it appears that nurses often don't have each other's backs. And the administration doesn't have the nurses' backs. And the nursing associations may not have the nurses' backs. And they're voting to go with unions that are known to be very aggressive to be sure that their views are represented now.
Yeah. So that's, that really brings me to really just a combination of things here. First, I was thinking a funny thought because I always remember that whenever I would be nervous for like a test or something, I would all of a sudden need to go to the bathroom.
Yep.
And I feel like that's, just the most basic example. And most people experience that. For my husband, it's like when he's really happy, all of a sudden he has to go to number two. And I'm like, that doesn't, but it's that, that mind for me, I always experience it in my gut, like the GI connection. But I also talked with Teresa Sanderson, who is the champion for the Nurses Feed Their Young movement.
Yes.
And she explains how you can recognize that you are burned out. And it may not be what you would normally think, right? So you're burned out, you're in a place at work, maybe you're in a toxic environment, or just the stressors are getting to you. And all of a sudden you start to experience things like insomnia. Thinking, how does insomnia have anything to do with it? You would think the person would just want to sleep all the time, right? But insomnia, they're dealing with fatigue, they're dealing with just kind of overall exhaustion, powerlessness, depression, right? So you're thinking about something going on in their mind, right? In their mental state is now affecting how they show up physically on a day-to-day basis. So this connection cannot be overstated. I think even the layperson can explain it in lay terms and say, yeah, I do notice that whenever something big is coming up, I start to get nervous. And then all of a sudden my armpits are sweaty, right? Like even that, is an autonomic response that we're aware of. So there is scientific backing to this concept. So I really appreciate that you guys are using the human experience as really your guideline and your foundation for coaching other nurses. So I also want to talk about how understanding our thoughts, right, can change the way we experience like stress and illness or even burnout as nurses. Why is it important to understand and then capture those thoughts and kind of switch them around? And how do we do that so that our mind is not controlling every aspect of our lives in a negative way?
Well, I just had a thought about that. Basically, the way I see it now is in holistic nursing, we put a lot of emphasis on the environment.
Mm,
And the environment that's out there is what can be seen, heard, felt, touched, and all of our senses. What the principles are actually referring to, well, we could describe the environment as in one word as the word form.
mm,
But the principles are even more basic than that.
mm,
The principles are referring us back to the formless,
mm,
that which is there originally, initially, before form even comes into being.
mm,
And so it's the universal power of life,
mm,
the universal mind, the universal thought, the universal consciousness that we're all part of. So in regard to thought in particular, and you'll hear more about this from Teresa, but we know that universal thought is everywhere.
mm,
And yet we have our own personal thought that is part of that universal thought.
yeah.
And we put a lot of store in our personal thoughts and deciding, well, I'm going to do this or I'm going to do that.
Mm,
But it's time for us to take a step back and be ready to open our ears, open our consciousness to what is coming into us.
mm,
We're not just senders, we're also receivers.
mm,
And when we can listen inside ourselves to the internal guidance, the internal wisdom that is always there, we'll be more on the right track of where our lives are going.
awesome.
Teresa?
Yeah.
I think,
Teresa, I think I have like a different question for you along the same lines, right? So
okay.
let's have like a practice coaching session, and for the benefit of the nurses and whoever else is listening, can you just give me maybe two or three strategies that nurses or my listeners, anyone, can use to manage their stress and anxiety if they find themselves in a high pressure situation or an environment?
So one of the things that we know for a fact is stress affects our bodies, right?
Mm-hmm.
Everyone knows that. We hear it all the time that stress is killing people.
Mm,
Well, where does stress come from? So doing a quick check-in with yourself, like if you're at work and things are really stressful and you feel really sped up and you're like, I don't know what to do in this moment. I just want the world to stop so I can think.
mm,
That thought alone, if you know that you're thinking in that way,
mm-hmm,
and you understand that thought is something you can control,
mm,
you can take a breath, literally
mm,
a breath, and go, oh, I know what's going on here.
mm,
I'm the one feeling sped up. Let
mm,
me stop for a second, do a
mm,
reset, do a deep breath. Every time you take a deep breath, clear down into your belly.
mm.
It massages your vagal nerve, and it will actually slow down your thinking.
Wow.
And so that in that sense, you can see how your breath is connected to your thought,
Mm,
to your body, and
mm.
to everything happening around you.
Yeah.
And I think when we realize that thought is the power. I've been to many conferences where they've said everything that we ever done started as a thought.
Mm,
Sped up thinking starts as a thought. Happiness starts as a thought.
mm,
Love, the feeling of love is a thought. You can't give that away, but you can feel it.
Mm.
And so when we remember that the stress hormones come through our body when we've decided that we're under some kind of attack, right? So when you were talking earlier about like the indigestion or the fatigue or the any number of symptoms, even high blood sugar, that's an activation of the hypothalamus pituitary adrenal axis
Yeah.
that we all know what that feels like. When we know that that's our body trying to help us, we can actually look at it different and go, oh,
Yeah.
I don't have to stay here. So for example, one day I was quite upset about something on my way to work. I think I was getting called in on my day off. And I was talking to Lynn and I'm like, I'm just angry right now. And I caught myself saying, I just want to feel this feeling. And I turned the corner into the parking lot and I started laughing because I went, you're just now living in the feeling of your thinking.
Yeah.
And you don't have to.
Yeah. Yeah.
And so in the realization of the recognition that I didn't have to, I started laughing.
I love that term, living in the feeling of your thinking. Wow. It's so interesting. I just talked to someone yesterday and we were discussing the book Battlefield of the Mind. And I've been going through that with like a daily reading or daily devotional. And it talks about thinking about what you're thinking about, you know, and making sure that whatever thought comes into your mind, sometimes it just happens into your mind. Like you don't have control over it, but you have control over what you do with it. You don't have to live in the feeling of whether it's bitterness or offense, sadness, anger, just whatever negativity comes into your mind, you have the power to get rid of it, push it away, maybe replace it with a different positive thought, or talk yourself through that emotion and understand why you're feeling it, but not stay in the feeling of it. If I'm saying that term right. And so I really appreciate that as being a basis for healing your mind and your body, because eventually it'll be more automatic, right? Like a negative thought flies in and you're like, the more you practice doing that, the easier it'll be to kind of be like, all right, I will either think something different, say something different to myself. So what did you do in that moment? What was your strategy to really get rid of that negative thought or maybe turn it around?
Well, it was in the recognition that I actually didn't want to live in that feeling.
Yeah.
Because feelings are like clouds. They come and they go. Literally going around the corner and into the parking lot and laughing because you can't actually feel two emotions at the same time.
Yeah.
You can't, think love and feel hate or feel hate and think love. You can't do it. And I chose love. I chose the better feeling. And I had to laugh because I knew I did it to myself.
Wow.
So when I walked in the door and my daughter was the receptionist at the same day surgery area, and she goes, well, you're in a much better mood than I thought you'd be. And I went, you're right. And
you chose. Yeah.
Yeah.
You chose. We can choose. We can choose. That's amazing.
Well, I was thinking about, yeah.
Well, that's it exactly. So in regard to our physiology, we're no longer being, in this country, we're no longer being chased by tigers. Yeah. And that stress response is intended to work for us for 30 minutes every 24 hours. Beyond that, there's no physical benefit to our bodies. We are choosing to allow stress into our lives on an almost 24-hour a day basis now.
And the body was not meant to handle that. Wow. That's amazing to hear. Wow, I could talk about this topic all day because I think nurses will really, really resonate with this, especially as we're living in this culture of, burnout, toxic workplaces, and people pushing for that narrative to change. This would really inspire nurses to take control of their thinking and maybe improve their outcomes greatly,
Well, and
But
Teresa, you could say that you had an insight about not wanting to stay in that angry
yeah,
situation.
yeah, absolutely.
When you realized
Yeah.
that you didn't want to be there, that was
Mhm.
an insight on your part.
Okay, so I want to ask you guys, how do you think that healthcare can be transformed, especially nurses transforming healthcare using this inside out model? And Teresa, I'll start with you.
So, I think it's going to come through nurse coaching, because when we understand how we work from the inside out, and as nurse coaches, we actually transform the whole entire healthcare system, because we begin to understand how we work. We become nicer people. We become less stressed because we actually know how the inside out works. Um, Nurses are great at doing all of the tasks and all of the things, but the most important part we bring to the equation is our actual ability to problem solve
Mm.
and to be a part of the solution to what healthcare needs right now. I don't think healthcare is going to change, because we say so. It's going to change because we change as human beings.
Mm.
And this inside out nature that we have, when we understand how it works for us, we automatically know how it works for someone else.
Mm.
And we become better communicators, we become better problem solvers, and we become a more cohesive profession as nurses, because we really want to elevate the profession of nursing.
Yeah.
If we don't do it, no one else is going to.
Yeah.
We have to be the people at the table, showing the public, showing the leadership,
Mm.
this is what a nurse can do.
Yeah.
And it starts with us. It's not going to come from somebody else. It's us.
Yeah.
And nurse coaching will do that for people.
Yeah, absolutely. I think if we can really state our own value proposition and not allow others to dictate our values for us,
Right.
and really find our voices, right? Because, like you said, we have been kind of acculturated to this background role. Like, we're just sort of in the background, we're just there to help and really tap into our own scientific backgrounds and not just be task doers, right? But think about why we're doing what we're doing. That will truly transform healthcare for the better, right?
Yeah, everyone can learn a task,
Yeah.
but doing the art and the science of nursing, that is our profession,
Yes,
and we're really good at it.
absolutely. All right. And Lynn, I'll have you also.
Okay, yeah, it's that critical thinking piece that is the most important. If you see something, you connect it to a diagnosis that you saw, and then all of a sudden things change. Somebody is in your room now and in the emergency room 20 minutes later.
Mhm.
So you just see things and you know things that the public is not aware of.
Mhm.
I had the privilege 6 years ago of writing a little article, the title of which was "The Revolution Begins in Nursing."
Hmm.
Well, that revolution is actually the inside out revolution, and
Wow.
it's already begun, but we're bringing it to nursing now,
Mhm.
because nursing is the world's largest health profession. 4 million of us in the US, 14 million worldwide. The docs are the second largest, and there's only 1 million compared to our 4 million.
Mhm.
So there couldn't be a better group of people. As the Gallup poll shows every year, that nurses are the most trusted. They're the most ethical and the most honest of professionals. And that's how the public trusts us. So we'll be able to connect directly now to our public. The inside out way of living is already known in 63 countries, more than 63 countries worldwide.
Mhm.
And it's just our privilege to be bringing it to the profession of nursing.
Thank you so much. And can you talk quickly about that piss lily?
Oh, yes. I wanted to say, in spite of the fact that the name of the article was The Revolution, I
Right.
actually did put a peace lily as the image on the article, because it is already happening as a very peaceful revolution.
For sure. Okay, so let's transition now. I want to talk about your exciting new kind of role in tech, and I know that you've kind of found this new passion, and you're intersecting tech with holistic health and really just the human connection. Can you talk about this? Talk about the A ring. Talk about what excites you about the new work that you're doing, and really just what you're seeing as the future of nursing, especially in this tech space. So it's a loaded question, so just talk all about it.
Well, first of all, I just want to spell it. It's hard to hear the difference. It's the Greek word for life, A-Y-U-R.
Ayer,
Yes.
yes.
A-Y-U-R. So, Teresa?
So Lynn and I, 5 years ago, went on the Nurse Hack for Health because I had this idea that I wanted to create an app. At the time, it was for our school because I knew how powerful the information is that we have in our school, that I just knew it would change lives if people could just get it in their hands when they need it, right? So I did a Nurse Hack for Health, and we created a minimally viable product, and I didn't win. But 5 years later, I meet a man named Alex Bridgen, and his presentation was to use biometric markers in a ring, and one of them is stress detection 3 to 5 minutes before you feel it. And I thought, if we could interrupt stress, yes, please, because I knew that that was one of the main sources of all disease.
Yeah.
And the more that I listened, he was putting it with nurse coaches so that the people would have access not just to their biomarkers, but to what he's calling an AI concierge, which is like a coach in your pocket that will reflect your thoughts for you and allow you to begin to see your own patterns as related to your health biometrics. And then when the patient or client is ready, they can actually connect with a real live nurse or health provider, actually, to explore further options or to get accurate information. But as nurse coaches, we can really help people see their own internal wisdom. And in my view, it will help with mental health greatly. Health anxiety is such a big deal right now. People are almost afraid even to get the test because they don't know what to do with it.
Yeah.
This will help bridge that gap. But the other thing it does is creates a community of health providers with end users or clients who really do value their health, and creating a movement of people who really we want to stop being in sick care. We want to enjoy our lives. I don't want to think about health 24/7. I just want to be it.
Yeah.
I want to be healthy, enjoy my life, go on picnics, be with my family.
Of course.
And so the end result is when you no longer need the ring, you just go and live your life because you understand how life works. And I think it will just decrease a lot of the doing, like I got to do this and I got to do that. And, but, how many modalities and treatments and pills and whatever else you can do. Yeah. What if you were just already innately healthy and you knew what that looked like? So really, it's what does health feel like? And that's what we're bringing, the feeling of health and connection. And I think we have to bring back the community of people who come together and give that love and attention and the presence that people so much crave.
Well, and those words, innate health, are so important. What we as nurse coaches can do now is to see the perfect health in every individual, no matter what their diagnosis, what their situation in life. We're no longer looking for the problems because those tend to multiply. And what we want now is to be able to see directly ourselves as the practitioner, the health in the other individual, and help them to find it also.
Awesome. What stage are you all with rolling out of a ring?
Cross your fingers. The app launches this week.
Oh, yay. Congrats. That's wonderful.
The Android is ready. The Apple is giving a little bit of problems, but we're problem solvers. We'll figure it out.
Yeah,
And
that's great. And so how is this different from other wearables, right? One thing that you mentioned, and I think is really fantastic, is that it can detect stress before it happens. How does it do that?
it notices increased heart rate or
Mm,
decreased heart rate variability, which is an indication of stress. So it can actually begin. It's more about seeing your patterns of where these are happening for you. And then once you begin to recognize the role that thought plays in your patterns, you can begin to help understand your health better.
mm,
And a lot of people, it does have an AI concierge. We call it like your own personal little coach.
mm-hmm,
The one thing AI can never do ever
mm,
is critical thinking and human connection.
mm.
Individuals have to do that for themselves, which is why we need human connection
Yeah.
to
And
help.
that's where the nurses come in
Hmm.
and the coaches. Yeah.
Absolutely.
Yeah.
It'll not yet, but eventually we'll have like in communities where people can ask questions
Yeah.
inside the app.
Yeah.
And
That's wonderful.
Teresa, how is it going to be beneficial for women to know their basal body temperatures?
Well, fertility and
Fertility.
menstrual protection. That's right.
Yeah.
It will also have a continuous glucose monitoring capability, which is about every 15 minutes.
Mhm.
Is considered continuous.
Yeah.
So it's, and remember, no wearable can really diagnose or treat you. It's
Mhm.
giving you clues to your own health so you can
Mhm.
talk to a healthcare provider,
Absolutely.
because there's a lot of misinformation, a lot of wishful thinking.
Mm.
We see a commercial every day that says, if you do this, it will fix your life, right? No, it's not true.
Right. Right.
Um, it comes with insight. It
Yeah.
comes with realizing, oh, I didn't even get 2,000 steps today. Maybe I want to take care of that,
Yeah. Yeah.
and begin to make those kinds of changes as insights come.
Yeah.
Well, and that idea of steps is really a good one, Teresa, because the way we see ourselves as nurse coaches is walking along beside the patient and
Mm.
maybe a little bit behind because
Mm.
they're in the lead.
Mhm.
It's their health journey,
Right.
and we can help point the way, but they have to decide for themselves. I mean, it couldn't be a better situation for a nurse to
Right.
have the patient rediscover their
Mm.
own power in
Yeah.
their lives. And
Mm.
some of the solutions that they come up with are way outside of the book. You would never have imagined
Yeah.
that their answer would work. But
Yeah.
because it was specifically made for them, it came through them, they know exactly how to take the next step. And it does work.
Yeah. That's wonderful. I know that we are kind of running low on time now. Let's start to wrap up. This conversation has really been impactful. My final question is really like a message of inspiration, right? If you could whisper one message into the hearts of every nurse out there right now, whether it has to do with the mind body connection, about healing from the inside out, if you could tell the nurse one thing, especially if it's a nurse who's dealing with stress, anxiety, burnout, and all of these emotions that can sometimes plague nurses because of the high stress environment that we work in, what would that message be?
Well, I would tell her that Florence Nightingale told us in the year 1870 that it would be 150 years before people would see the kind of nursing that she envisioned. That'll be the year 2020 when
Mm-hmm,
everything changed. We
mm-hmm,
have the opportunity now to rewrite the definition of nursing and rewrite the work that nurses do.
mm-hmm. Awesome.
And I would say, if you're feeling defeated and frustrated and want to quit, that you're not broken. There is nothing lacking in you to have the life that you want.
Mm-hmm.
And if you want to join the conversation, we would love to have you, because I know that through conversation and support and being part of this larger community of nurses who really do care about nursing and people, nurses are people, and we need each other to survive and to thrive.
Yes, we do. That's wonderful. Thank you so much for sharing that. Where can people connect with you? Where can people go to find information about advancing coaching? Tell people where they can reach out.
Well, that's our website, nursecoaching.com. So that's the easy way to find us. Our full name is Advancing Nurse Coaching. And we're on all of the social media.
Awesome. Awesome. And I'll have all of this in the show notes. But before we go, let's play our game real quick. First, and I'll throw out this question to you, Teresa. Do you have any shows that you've watched in the past? And if so, what are your thoughts about how nurses are portrayed in media?
So I don't know if anyone's watched yet. The Pit is that brand new series, right?
Yeah.
I have to say, it touched on every single issue that nursing is having, nursing and healthcare in general.
Yeah.
Not just nurses, but like, children and having trouble in school, parents wanting to know what to do.
Yeah.
Quality improvement lady was there.
Yeah.
The whole thing. And I thought, and the one nurse that was there, she was kind of holding it all together and kind of, redirecting and showing people like, hey, no, these are the things that we want to point to and take care of. That's actually not important right now. And I think nurses do know. So I think for me, that show had many aspects.
One of the most accurate so far, yes.
Yes. Because I've watched some other ones and I'm like, nurses don't do that. Nurses do not go from room to room, crack open chests, hold people's hands, deliver a baby all in one episode.
Right.
Yeah, I don't think so.
Also, nurses do that, right? Where they portray the physicians doing the stuff that nurses would generally are the ones who are usually do those things in the hospitals. They'll have the doctors doing those tasks, and I'm like, nope, that's not true.
Right. Yeah.
So it's either one way or the other. But I think this is shedding a better light on the work that we do and making more accurate depictions for our profession. So I'm grateful for that. All right. Can we play our game? Are you guys ready?
Sure, let's play it. See what comes up.
All right, we're gonna wrap up with our game here. Okay, so Miss Lynn and Teresa, I have a jar in front of me. I'm going to shake it around, pick a category, and you get to put on your producer hat and write the script for a show or a movie or a book, whatever it is that I pick out that features a nurse in the lead. You ready? Okay, let's shake it around.
I'm scared.
You're scared? Don't be scared. Okay, this is new. So your category is novel.
Oh, that's an interesting one because I had an idea for a book a long time ago.
Nice.
And I wanted it to be the day in the life of a nurse from the inside out with her internal dialogue speaking the story as the day unfolds. Wow. So the idea was to walk in the door, and you've seen where like in the Christmas movies, and it's quiet on the outside and you open the door and all the activities on the inside. So everybody's playing their role. Everybody knows what to do. And I walk in the door and it opens up and the first person I meet is they're late again. I'm not going to know what to do until I can't do anything until they finish their part of the chart. And they're like standing there tapping their finger. And I'm like, oh, she's not having a very good day because
and this is all inner dialogue.
This is inner dialogue. So I'm hearing her thinking, like, this is what's happening again today, Groundhog Day, right? Well, the next day I walk in the door and she's the same person meeting me at the same place at the desk. Well, the patient's not ready again today. I guess I'll go get breakfast. And in my mind, I think, isn't it interesting that day to day, the tasks don't change, but the internal dialogue does. One day it's a problem, the next day it's not. And I wanted to write the story as if the nurse understood that everything she experienced was only coming to her through her own thoughts.
Oh,
And to
wow.
watch how she could navigate her day based on that.
Wow. That was excellent. So, I mean, it's like seeing the situation, same situation,
Mhm.
but almost flipping your response to it. Because the situation is not as important as how you respond to the situation, right? That's where this term comes from. Was it a bad day or was it a bad 10 minutes that you stretched out for the whole day?
Right.
And so being able to flip that and turn your day differently, put a positive spin on things, right?
Mhm.
That was amazing. Thank you so much for sharing. Lynn, I'm not going to stress you out to give me your own category. I'm going to just wrap that in a nice little bow there. Thank you guys for being my guests. I really appreciate you talking about this incredibly important topic that affect all of human life, right? Not just nurses, but everyone. And it's been a pleasure to talk to you and to host you today. So thank you for coming on. Thank you to all my listeners for being here and sticking with us till the end. Please like, share, and subscribe. And I hope to see you next time. Bye bye.
Thank you.
Thanks for hanging with me till the end. I hope you gained some valuable insight into the world of nursing. If today's episode inspired you, please like, subscribe, and share with someone who needs to hear about the amazing work nurses are doing. Let's keep breaking stereotypes and reshaping the narrative together. I'll see you next time.